Goniometric measurement of talocrural dorsiflexion. Talocrural range of motion occurs in the sagittal plane around a medial lateral axis between the articular surface of the talus and the distal end of the tibia and fibula, the surface that composes the ankle mortise. During open kinetic chain motion, dorsiflexion of the talocrural joint, the convex talus moves on the concave ankle mortise with a dorsal roll and a plantar glide. The end feel of passive dorsiflexion range of motion is firm due to the tension that's placed on the posterior joint capsule, the posterior muscles like the gastrocs and the soleus, as well as the Achilles tendon. It should be noted that while measuring passive dorsiflexion range of motion, a considerable amount of force is needed to overcome the passive tension of these structures. Full extension of the knee should be avoided during testing in order to decrease the tension that is placed on the gastrocs, the two-joint muscle that crosses both the knee and the ankle. By extending the knee, the gastrocs can become passively insufficient and decrease the available range. Flexion of the knee allows more motion at the ankle due to the slack that's put on the posterior structure of the leg. The muscles involved in producing active dorsiflexion include the tibialis anterior, extensor digitorum longus, and extensor hallucis longus. A weakness in any of these muscles may lead to decreased active dorsiflexion range of motion.
Talocrural dorsiflexion range of motion may be measured in instances of gait deviations when there is a patient history that involves past surgery or injury at the ankle, or if there is pain with movement. Measurements allow clinicians to observe the willingness of the patient to move as well as detect deficiencies in the patient's available range. Talocrural dorsiflexion range of motion is contraindicated in patients with dislocations or unhealed fractures in the region and in instances of bone fragility. Measurements should also be avoided immediately following surgery or injury due to the presence of tissue damage and inflammation. According to a study performed by Clapper and Wolf, inter-rater reliability of goniometric measurements of talocrural dorsiflexion was 0.92, indicating a high reliability within one individual tester. Currently, there have been no tests completed to assess the validity of dorsiflexion range of motion according to Norton and White.
In order to palpate appropriate structures and observe motion at the joint, the area to be tested should be exposed. The patient will be seated at the edge of the table with their knee flexed to 90 degrees and the ankle flexed to 90 degrees. Neutral subtalar inversion and eversion. A towel may be placed under the distal thigh for comfort. The therapist will take an eye-level measurement, placing one hand on the bottom of the foot with the movable arm of the goni, and the other hand at the posterior leg with the stationary arm. The axis of rotation of the goniometer should be placed at the lateral aspect of the lateral malleolus. The stationary arm is aligned with the midline of the fibula, with the distal landmark being the head of the fibula. The mobile arm is placed parallel to the base of the fifth metatarsal. Non-weight-bearing active dorsiflexion range of motion is approximately 12.6 degrees. Active range of motion may be greater than the passive measurement due to the force required to overcome the passive tension of the posterior structures. In order to produce greater range of motion at end range, patients may compensate by extending the knee. At the end range of motion, resistance to further motion is felt.
Hi Stephanie, my name is Erin Lee. I'm going to be your therapist today. What we're going to start with is measuring ankle range of motion. So specifically we're going to look at dorsiflexion of that talocrural joint, which is pretty much just seeing how close to your shin you can lift the toes. Does that sound okay?
Yeah.
Alright. I'm going to measure it using this. It's called a goniometer, and it'll just help give us an objective measure of the range of motion. Alright, so I'm going to start by putting your leg on this little bolster here. Just elevate you up a little bit. And then what I'm going to do is just find your ankle's neutral position here. Feeling the head of the talus. Good. And I'm just going to palpate for a few landmarks. Get you up to a starting position here.
The stationary arm in line with the fibular head, the axis of rotation at the lateral malleolus,
and the mobile arm parallel to the base of the fifth metatarsal.
And from here, what I want you to do is pull your toes towards your shin as much as you can. Just try and flex that foot. Good. Alright, looks like we have about 14 degrees there if you want to relax. And now we're going to do the same thing, only this time I want you to relax and I'm going to push your foot up. So we got about 10 degrees there. Alright, that's all we have for you today.